Could I have prevented my child's cow's milk allergy?
We see a lot of guilt in the food allergy clinic, particularly maternal guilt about something they should or should not have eaten during pregnancy. But in terms of any food allergy and also cow's milk allergy, we just do not have any clear answers at present. There's some very old studies, again, conducted in Europe in pregnancy, where they either avoided cow's milk allergy during pregnancy or actually gave them a high dose of cow's milk allergy, and it did not have any effect in clinical presentation of cow's milk allergy. And that is also why the American Academy of Asthma, Allergy and Immunology, alongside other international allergy societies, very clearly state that we currently do not advise pregnant women to change their diet during pregnancy to prevent food allergy in the infant. That relates to allergen avoidance or increased allergen intake. And so really, to be honest, what we are saying is do as you're doing at the moment until we're in a better position to advise you appropriately.
And the same goes for breastfeeding as well?
The same goes for breastfeeding. There's currently no advice that we can give pregnant or breastfeeding women to prevent food allergy in their infant.
I think that's kind of a universal recommendation, that we really to avoid major allergens like dairy, cow's milk protein could actually have some harmful effect as well. And there aren't data to say that it actually will prevent in the mothers. When we talk about infants, there's past recommendations about 20 years ago said to avoid all dairy till you're age 1. And that was based also on some very limited data. And less than 10 years later, in 2008, they said you really should not be avoiding these things, but they didn't really say go and eat this amount to prevent milk allergy from developing. We now have some data with respect to peanut that says, based on a very large trial done with definitive results, that said if you introduce peanut early in a high-risk patient, which could be someone that has severe eczema or having egg allergy, you can prevent them from developing peanut allergy. And if you wait to introduce it until age 5 years, you significantly increase the risk of that child developing peanut allergy. We don't have the same data yet with respect to cow's milk. There's only been a limited observational study in Israel looking at about 11,000 infants, meaning they looked at a big population of infants and said, when did you give cow's milk a supplementation, within the first 2 weeks or after 2 weeks? And that did show that if you introduce it within 2 weeks, it may have some effect in preventing cow's milk allergy. Another larger trial, which was more randomized controlled trial, meaning they either gave dairy between ages 3 to 6 months or waited to give dairy after 6 months and see at age 3 years, did you have milk allergy or not? They really didn't see a result that it had the same effect. But this was a more standard risk population, meaning it didn't have to have eczema or severe eczema and or egg allergy in that population. So again, we don't have the definitive answer like we do with peanut, I think. There may be trials coming up that look at dairy specifically, but right now, I agree, the recommendations, whether it's for infants or parents, are not to avoid those things. Until we get more data, we'll say, does you have to introduce those at a certain age? We need to find out.
Yes, and just to clarify, when we talk about early introduction or not of milk or dairy in the infant's diet, so before 12 months of age, we do refer to the use of infant formula or milk-containing foods such as yogurt, but we do not recommend cow's milk as the main drink for infants for nutritional reasons opposed to allergy reasons. And then I think just getting back to the pregnancy diet as well, looking at supplements, there's some data indicating that supplementation with lactobacillus GG and omega-3 fatty acids during pregnancy and then continued during either breastfeeding or the infant's first 6 months of life or both may prevent sensitization to some food allergens, egg, peanut, and milk, but nobody has been able to show that supplementing with either probiotics or omega-3 fatty acids can prevent clinical presentation of any food allergy.